Hi, it's Dr. Centeno, and I'd like to talk about A2M or alpha-2 macroglobulin and whether or not concentrating it makes any sense. Now, I'm going to try to aim this talk at a physician level and a scientist level, but I'm also going to try to do it so that the average patient can understand, or the educated patient can understand, because at the end of the day, that's also very important to me. So, in general, at Regenix, we're pretty agnostic as to what technology produces results, because as a group medical practice, we deploy a flexible lab platform that can create biologics that are tailored to fit the patient's needs. So if A2M is important and concentrated, then we'll concentrate it. If certain types of platelet-rich plasma work better, or certain types of bone marrow concentrator, or whatever it takes to get the patient better. However, we also want to look at this and try to see if this makes sense. So let's delve deeper into the A2M story, because there's been a lot of aggressive pushing by medical sales reps selling machines to concentrate A2M, trying to convince doctors that this is the best thing since sliced bread. So is it the best thing since sliced bread? Is it important? Is it something else? So if we look at any joint, it's always a balance between repair and maintenance and breakdown. On the one side of repair and maintenance, we have lots of different things that can keep a joint healthy. And at the same time, there are lots of things that can break down a joint. Go for a workout, you can break down cartilage. And in general, I'm not going to get into these specifics, but that's the concept. You've got repair and maintenance and breakdown, because A2M is all about the breakdown side and how do we change that equation. And it's not just A2M, there are lots of other things involved there. So we have all of these things that are involved in repair and maintenance. We have all of these things that are involved in breakdown. So the bad guys are some cytokines or chemicals that live in the joint that can break it down. And in particular, the ones we're talking most about are what are called matrix metalloproteinases, or MMPs. Lots of different types of MMPs. They break stuff down, and particularly they break cartilage down. So in summary, for patients, the bad guys are nasty chemicals that break down cartilage. Obviously, you've got less cartilage in the knee because it's been broken down, you're going to get arthritis. Now, there's also what I call the bad guy factory. These are inflammatory chemicals like IL-1 and TNF-alpha that can enhance MMPs and make them more efficient at breaking things down. So for patients, we also have inflammatory chemicals in the joint to enhance the activity of cartilage breakdown bad guys. Now, there are ways to foil the bad guys. There are anti-catabolic cytokines, and there's a long list of those, of which A2M is one. TGF-beta, which is found in PRP, will do that. TIMP-1 and TIMP-2 will do that. IRAP will do that, as well as alpha-2 macroglobulin. So again, for patients, certain natural chemicals like A2M and many others can block the bad guys from breaking down cartilage. Now PRP, there are lots of different studies that show that PRP works to inhibit the breakdown of cartilage. So this is not a new story. Many people think that with A2M, this is a brand new story, that we have something that helps to stop the breakdown of cartilage, but that is not the case. Common PRP will stop the breakdown of cartilage based on the animal data that we have. So again, for patients, PRP can also foil the bad guys like A2M. Now, there is a certain amount of A2M that reduces cartilage breakdown, and based on a 2014 study, That's about 150 micrograms per ml. It's an important number because at the end of the day, when we look at common orthobiologics in our lab, everything from serum to platelet poor plasma to bone marrow aspirate, all of it far exceeds that number. The 150 micrograms per ml is the red dotted line there. And everything that we tested has more than enough A2M to do the job. In fact, it's got a buttload more A2M necessary to do the job. In some cases, 3 to 5 to 6 to 7 times the amount that would be required to stop cartilage breakdown. So you have to wonder whether or not concentrating A2M makes any sense whatsoever, given how much of this stuff is out there in pretty much everything. In addition to that, when we look at patients in our knee microenvironment study, and we take synovial fluid samples before a procedure, a REGENXBC stem cell procedure, and after a REGENXBC stem cell procedure, the good news is we're not only seeing that the stuff we're injecting has a lot of A2M, but we're seeing days later that the joint itself, the joint fluid, has a lot more A2M than it used to. So the procedure seems to be markedly increasing the amount of A2M in the joint. It's also markedly increasing things like TIMPs and other things, so not just A2M. So again, very good evidence that a REGENXBC procedure is accomplishing what we want there in producing an increase in cytokines that will reduce cartilage breakdown. So in conclusion, A2M is one of many important molecules that inhibit cartilage breakdown in animal models. Many common autologous biologic injections like serum, platelet poor plasma, platelet rich plasma, and bone marrow concentrate contain concentrations of A2M that are higher than those that have been shown to inhibit cartilage breakdown in the peer-reviewed research. And our patented REGENXBC procedure, based on the early data from the knee microenvironment study, markedly increases A2M levels in the knee synovial fluid of real patients 2 to 4 times above the levels that inhibit cartilage breakdown. So at the end of the day, I don't see a rationale at this point for aggressively concentrating A2M, and until I see one in the peer-reviewed literature, it doesn't make sense to me to head that direction. But we'll be testing all of it, again, in much more detail than anyone else out there as part of our ongoing knee microenvironment study. Thanks so much for watching and have a great day.